Parkinson's disease is a neurological disorder. The neurons in the substantia nigra in the brain die, causing a deficiency in dopamine. Dopamine allows the coordination of body muscles and movement. Symptoms of Parkinson's disease include bradykinesia, which is the slowness of movement, muscle rigidity, shaking, tremor, and problems with balance. You can memorize these symptoms by peanut butter, toast, and raspberries. Peanut butter as in postural instability and bradykinesia, T for tremor, and finally R for rigidity. Symptom progression can cause severe disability, making the patient unable to walk or feed themselves. Note, tremor usually starts at one side of the body and eventually progresses to the other side, making it bilateral. Now we are going to start with the treatment of Parkinson's disease. The most effective agent in the treatment of Parkinson's disease is levodopa, a precursor of dopamine. Levodopa is given with carbidopa to prevent the metabolism of levodopa in the periphery by inhibiting dopa decarboxylase enzyme. Carbidopa levodopa is available as 25 to 100 mg tab to be taken 3 times a day. Carbidopa must be taken at a dose of 70 to 100 mg per day to inhibit dopa decarboxylase. Side effects of carbidopa levodopa include nausea, vomiting, orthostatic hypotension, hallucinations, and psychosis. Note that carbidopa levodopa must be separated from protein-rich food. As the disease progresses, carbidopa levodopa is not enough to help the patient, so we add another medication, which is catechol O-methyltransferase inhibitors, also known as COMT inhibitors. Entacapone, a COMT inhibitor, is available with levodopa carbidopa under the brand name Stalevo. Adding entacapone allows us to decrease the dose of levodopa by up to 30%. This decreases the side effects associated with high levodopa levels. Another COMT inhibitor is tolcapone. Tolcapone is not as used as entacapone due to its hepatotoxicity. Another class of medication used to treat Parkinson's disease is dopamine agonist. This class of medication includes Pramipexole, Ropinirole, Rotigotine, and Apomorphone. Apomorphone is contraindicated in patients taking serotonin antagonists such as ondansetron, allosetron, granisetron, due to the severe hypotension and loss of consciousness. Another class is the monoamine oxidase B inhibitors, such as Selegeline, Rasageline, and Safinamide. Note that Safinamide causes severe hepatic impairment and that MAO-B inhibitors are contraindicated in patients using opioids, SNRIs, and TCAs due to serotonin syndrome. Anticholinergics such as Benztropine are given in patients younger than 65 years old with resting tremor. Side effects include dry mouth, constipation, urinary retention, blurred vision, somnolence, and confusion. The last medication we will be talking about before we go into which medication to give is Amantadine. Amantadine is used as an antidyskinetic agent. Side effects include insomnia, dizziness, orthostatic hypotension, dry mouth, and livedo reticularis. Livedo reticularis is a reddish-skinned spiderweb-like discoloration. So how do we choose which medication to give, or which medication to start the patient on? If the patient was started on levodopa carbidopa, we can add a COMT inhibitor such as entacapone, or a dopamine agonist such as pramipexole. If the patient is younger than 65 years old with resting tremor, we can add an anticholinergic such as Benztropine. If the patient is older than 65 years old, consider adding Amantadine. If the patient is suffering from dyskinesia, we can either decrease the levodopa dose, add Amantadine if the patient wasn't taking it before, or remove the dopamine agonist. With this, we reach the end of today's video. Don't forget to comment down below what other topics you would like to hear about, and until next time, stay happy and stay healthy.